Okay, I want to welcome everybody tonight. I'm so glad you could join us. And for those of you that are listening to the recording, I want to welcome you as well. For those I haven't met in person, my background is as a nurse practitioner and diabetes specialist. And after many, many years of working with people with diabetes and heart disease and overweight and seeing all the damage that inflammation can do, I now spend my time mostly educating people about how to prevent and reverse those problems. So I'm glad that you're here, and hopefully you'll learn something that will be helpful for you. If anybody did bring a guest tonight, if you remember, if I promised you samples of your choice of Balance Complete or Matcha, so remember that for the next presentation as well. The recordings that I do are available by email, so I have to have your email address in order to send those to you. So I think that's all the housekeeping things I need to attend to. You might want to have a pen and paper handy to jot some things down. I will email you afterward with some information that I'm sharing also. So let's bring up the PowerPoint here. All right, so tonight we're talking about inflammation and what's really happening with our bodies. So many people have so many problems with this. And what really is inflammation? Well, it's a natural response. If you get injured or you get an infection or come in contact with foreign substances, your body has this response to protect you and heal you. So inflammation is a necessary part of our makeup, but our goal is to balance it and not eliminate it. We need it to fight off these invaders. And when we talk about inflammation, any diagnosis that you or anyone has that ends in itis, I-T-I-S, that's inflammation. So like bronchitis, tendinitis, cystitis, can be a result of an infection or overuse, all kinds of things like that. And any cell or any organ can be affected, and we all have certain genetic tendencies that we're more likely to get than others. So there's two different types of inflammation, and that's a chronic or acute. And acute, of course, is something that just happened and it gets red and it's painful and it's swollen. And then we have chronic inflammation. That can be from like chronic repetitive use, like you get a tendinitis, or it can be chronic diseases. And chronic diseases are mostly considered to be caused by inflammation. We have so much problems with allergies. It's the 6th most common chronic disease. There's been a 100% increase in hay fever in the past 3 decades. 25 billion people have asthma. So lots of allergy type things. And we're going to talk in a little bit more about the causes. But the reason I bring up this slide on obesity and overweight is because it affects so many of us. And our fat cells release pro-inflammatory proteins, and that's a major cause of inflammation. Overweight people have extra stress on their joints and everything, but they also have a lot more inflammation being released from their fat cells. As those fat cells get bigger, they have more capacity to do that. And that's only predicted to increase unless we do something about it. And heart disease also considered to be primarily inflammatory at the root cause, and very, still the #1 cause of death in our country. Diabetes is forecasted to double, so we have lots and lots of inflammatory problems going on. So what causes all this? Well, for those of you who have heard me talk before, I'm a major proponent of fiber, and it's not just me, but we totally have a lack of fiber. That's one of the causes of so much inflammation. We don't get enough fruits and vegetables. We have excess omega-6, and we get that from processed foods, animals and fish that are fed corn, vegetable oils, fat cells like I mentioned. the hormones that are added to meat and poultry, excessive gluten also is a cause. I don't know if you realize this, but the gluten content of wheat is up 500% from just a few decades ago. And that's because, now we get our wheat stalks are short and stubby and they sprout a lot. We don't have the waves of grain as we used to in the past. And so part of that changes was so that they could get a higher yield and feed more people, but in the process we are getting a lot of gluten. And then there's the excess sugar and other carbohydrates that we eat and drink. And what happens then is, again, we have those high insulin levels, and insulin is a very inflammatory hormone at high levels. An unhealthy gut, for those of you that listened to my digestive health presentation last time, we talked about that, but 80% of our immune cells are in the gut, so the gut needs to be healthy or we're not healthy. The pesticides and fertilizers that, if we don't eat organic fruits and vegetables, they can injure our body. We're exposed to numerous environmental toxins. That is going on daily. So there's lots of different causes of inflammation. And I talked about the fat cells secreting the pro-inflammatory proteins. If people lose weight, they have like a 60% reduction in their aches and pains. So there's lots of different causes. So what do we do about it? Well, the first treatment is to improve the ratio of what we call omega-6s to omega-3s. Omega-3s have just powerful anti-inflammatory properties. They've been touted for cardiovascular health for a long time, but they're very beneficial for any kind of anti-inflammatory action. Now, the omega-6s, if that ratio is in excess of what it should be, that's very inflammatory. So it's really the ratio is what is important. And like so many other things, like our overweight and type 2 diabetes, all of this started to increase around 1960. And of course, that's when we started having a lot more processed foods and fake foods and low-fat foods and all of that sort of thing. Research shows that if people can achieve a 4-to-1 ratio, omega-6 to omega-3, there's a 70% reduction in mortality. That's a chance of dying. Some experts that are really on top of this recommend a ratio of 1-to-1. The paleo diet gets the lowest ratio, and that's 0.79 to 1. So if people follow that absolutely strictly, they have a very good ratio. But for most Americans, that ratio is usually about 25 to 50 omega-6s to 1 on the ratio to omega-3s. So that's a huge problem, and so we need to increase the omega-3s, excuse me, and the sources of that are in wild fish. And we say wild fish because farm-raised fish, unless you can find the source of those farm-raised fish and know that they are fed properly, they're fed corn. That's not a fish food. And so we get a lot of inflammation when we eat fish that are fed corn, thinking we're having good, healthy fish. So the source is very, very important. But wild fish like salmon and sardines and mackerel and tuna are excellent sources. And then, of course, high potency purified fish oil is what most people, I think, I don't know of anybody that doesn't recommend a fish oil supplement anymore from a medical perspective, because there's so many benefits to it. The key is with omega-3 is you have to have get the therapeutic amounts. That means enough to keep you well and get you well, of what's called EPA and DHA. Those are the parts of fish oil that are healthy. That's what you want to have. So you need to look at a label on fish oil to see how much EPA and DHA there is. And then those two combined, you should be getting 1,000 milligrams or more a day to get adequate amounts of omega-3. So many of the over-the-counter products will only provide about 30%. If people are to say, yeah, you know, you ask people, are they taking fish oil? Yes, I am. I'm taking every day. And if you question them, they're taking one a day. And that's just, that isn't helping. So need the omega-3. And then we need to avoid the sources of omega-6s so we can get that ratio down. So we need to avoid processed packaged foods. We need to avoid vegetable oils. And we need to avoid eating animals and fish that have been corn-fed. And you'll notice more and more in the grocery stores, they usually have a section now that will say grass-fed for the meats. And that's very helpful. And then the fish are a little trickier item. Unicity has, in my opinion, it's the best fish oil that I have found. There is a prescription strength fish oil. I don't know if you know that, but that's used to treat high triglycerides. And Unicity has a very good amount of the DHA and the EPA into therapeutic amounts. You take 2 capsules, 2 capsules twice a day for a total of 4, and that will give you the amount that you need. And what I like about it, and I can't show you right now, but they're very tiny and easy to swallow. And I'll hold it up here, and I don't know if I'm getting it in front of the camera or not, but they're very tiny, they are easy to swallow, and they have the tiniest bit of orange oil, so they taste very good. They have absolutely no fishy aftertaste. So that's the omega-3 ratio that I wanted to talk about. And then the second treatment for decreasing inflammation is to have a healthy gut. Again, I talked about this extensively in the digestive health presentation, but almost all inflammation starts in the gut. The lining of a healthy gut is what is called medically semi-permeable. That means that the body knows what to take in and let out, and that's only certain things have the okay to go in and out. But when there is inflammation, then the gut becomes what we call hyperpermeable or leaky. It's called the leaky gut syndrome. And at that stage, when the gut is compromised, the bad stuff can get right into the circulation directly. And again, the causes of an unhealthy gut are numerous, but there's insufficient fiber. The good bacteria have to have adequate fiber because that's what they eat to survive. There's not enough of the healthy bacteria, what are called probiotics. There is the sensitivity to gluten. We mentioned how extremely high that has gotten over the past several years. Unicity's probiotic is called Bio's Life Probionic, and it comes in a box of 30 little sachets, and in the sachets there is they're little crystals that the bacteria are inside of, and so they don't get released until it gets to your gut, and that's where you want it to be effective. And they have 4 different probiotics in them, very, very effective for a variety of things, but very essential for keeping your gut healthy. There are many nutritionists that recommend people take a dose of probiotics every day. I always get probionics, which is the name of Unicity's probiotic. I always say that backwards. Another Unicity product that is excellent for improving the gut health is Life Fiber. This is a psyllium-based fiber, and it has numerous herbs that are all specific. There's a long list of herbs that are all specific for bowel health, and this is very effective for cleansing the colon. And if people want to do a thorough cleanse, the life fiber is part of our complete cleanse. So we have the life fiber, the Paraway Plus, which immobilizes any parasites, and then either nature's tea or aloe vera as the laxative effect. And of course, Unicity Balance. I mean, we have people that take Unicity Balance just for the benefits they see in their bowels and in their well-being. So in addition to the fact that it's improving cholesterol, glucose, and weight, tremendous bowel benefits as well, which is so important for reducing inflammation. So balance is reducing inflammation in the gut, and it's also reducing inflammation by decreasing the amount of fat that people have to produce that inflammatory proteins. So I have a guest on the webcast tonight. Sandy, can you hear me okay?
I can.
Okay. Well,
can you hear me?
Yes, I can hear you well. And so I'm just going to ask you to share your story about what's been going on with your digestive health lately.
Well, I had 4 or 5 years of off and on diarrhea, and then some severe diarrhea, never constipation. And I thought it was from some products I tried to lose weight, like Nutrisystem and Sensa, whatever they all are. They all would give me immediate diarrhea. And so I just kind of had problems, and then I had to have abdominal surgery for a large tumor, ovarian tumor, and then after that there were lots of problems. So I just kept couldn't figure out what was going on. So finally, Judy and I have talked, and I started on the probiotics and the fiber, the life fiber, and that I've been doing that for several months. And I am so much better. I can't even believe that I have more energy. The diarrhea goes away unless I kind of eat something maybe I know I shouldn't. And now I'm doing the Paraway for 3 months. We agreed to do that, and I just can't tell you how much better I feel. And no diarrhea unless I've eaten something wrong.
Yeah.
So I'm also starting the paleo, is that how you say it?
Paleo?
Paleo
Mm-hmm.
diet next week. And I've already started decreasing the gluten and sugar.
Okay, great. And I think you were mentioning to me the other day, Sandy, about your energy level being so different.
Oh yes, that's increased. I was, taking naps off and on because I would just feel exhausted, and I don't have that problem anymore. Once in a while, if I overextend with my grandchildren, but other than that, I am really have a lot more energy. I'm not needing to, and I didn't go to sleep. I would just feel exhausted and lie down.
Mm-hmm, mm-hmm.
So it wasn't that I was tired. I just felt like I was exhausted. Does that make sense?
Absolutely, absolutely, and that's what we find frequently. So thanks so much for sharing that. I really appreciate it. It's very indicative of how important our gut health is to us as far as overall health. So we'll just move on to the third treatment for inflammation, and that's digestive enzymes. Obviously, we need them for digestive health, and also immune system health, neurologic health. In fact, the digestive enzymes in some way or the other are, interact with all body systems. So we need to maintain those at therapeutic levels. That's something that people don't often think about. But if you're working with natural options and health foods and that sort of thing, you will find that that is a very important treatment for inflammation. And again, Unicity has a product called Enzygen Plus that you see on the screen, and that has all of the digestive enzymes in it. Plus it has some algae in it. That's what healthy fish eat in the wild when they're not farm fed corn. So if we don't eat wild fish, we're not getting that either. So it's another great product to consider to to add for digestive health to reduce inflammatory problems. And then the fourth treatment is additional nutritional support. We've been talking about different parts of our nutrition, like the fiber and the omega-3 and the enzymes, and the probiotics, but also you want to, whenever possible, and I know price is always a concern, but whenever possible, get your fruits and vegetables that are organic so that you avoid the pesticides and the fertilizers that are used in the non-organic raising of those. Limit or just eliminate altogether processed foods. Limit your carbs that you eat and drink so that you don't have those high levels of insulin. Eat grass-fed animals. And if you drink milk, you want to get milk from a dairy where they raise their cows on grass. So that's very important. Additional things are to have adequate vitamin D. Vitamin D is a big deficiency in our country, and I think a lot of it is related to the obesity, although personally I'm at a normal weight and I have a very low vitamin D level without supplementation. So, but it is true that the higher one's BMI, body mass index, or general size as calculated by weight and height, the lower the vitamin D levels are. We need to, well, not necessarily supplement, but get at least 2,000 international units a day, depending on what your blood level of vitamin D is. Vitamin D affects so much, inflammation being one of them, and there's just a long list of benefits to that, and health deficits if you don't have adequate vitamin D. So if you don't know what your level is, I strongly recommend that you get it tested. And then, avoid the fake and altered foods, the non-fat milk solids, low-fat anything, skim milk, butter substitutes, margarine, egg beaters, all of that fake stuff that started to come on the market about the time we started having all these problems obviously have a major role, and we just need to get back to eating real whole foods. Jane, can you hear me okay? I wanted to have you share your story.
Judy, can you
I
hear
can,
me?
yes. So I know that you've told me about your problems a while back and what you did to correct that. So why don't you go ahead and share that with the audience?
Well, just about 7 years ago, I was teaching tennis at a resort, and I was experiencing a lot of pain in my hands and taking naps. I was exhausted, and so I went to the doctor, and he in turn had me go to a rheumatoid arthritic doctor who told me that the only thing that she had for me was drugs. And she showed me the medication that she wanted to put me on, and I looked at it, I said, there's no way I'm going to do that. So it was about the same time, one of my colleagues I knew was into natural medicine, so I called her, and she told me to contact Dr. Chris Foley down in St. Paul. Now, Dr. Foley isn't just an ordinary doctor. He was the head of internal medicine at the University of Minnesota. So I knew I was going to be in good hands. And he has a naturopathic clinic in St. Paul now because he had to leave his position at the university because he couldn't stand to see how the drugs were affecting his patients. And right away he put me on the paleo diet. Dr. Foley has everyone read the paleo book. The first thing you do when you go to him. And he took me off the sugar, gluten, and milk and put me on some herbal medicine. But right away, within a month, I noticed the pain in my hands were leaving and also more energy. Of course, within 2 months, all the pain was gone. So I was very aware at that time that sugar was causing the inflammation in the body. And it was about that time that I contacted Judy because I knew she was into a preventive health care company, and when she shared what the balance does, how it blunts the absorption of sugar in the body, I knew exactly that I had to be on this product. And of course I signed up with Judy, and must say that I've never been happier. I went on the 13-week transformation program when it was first brought to us 2 years ago. And at that time, Judy was looking at my numbers, and she said, Jane, you know, of course, my father died of diabetes complication at age 45. So Judy knew that I was very concerned about diabetes from my family history. And she says, Jane, you know, your glucose numbers are at pre-diabetic levels. And it was 110, of course. After the transformation program, I was able to drop all my numbers by 20 points, my glucose, my blood sugar, my cholesterol, my blood pressure, and, of course, my weight. So that program really brought me down so my numbers are in the normal range. So I couldn't be happier. I know my mission and passion in life now is to help everyone out there who has diabetes and health challenges. So thank you, Judy.
Oh,
thank you for this product to me.
Yeah, you're very welcome. It's a pleasure to work with you. And, you know, besides the numbers being down, I mean, when we're talking about diabetes and heart and all of that, I mean, that's all inflammatory. And so your paleo diet has certainly paid off. So thank you so much for sharing that, Jane. Sandy, I know that you also, not your personal inflammation story, but a family member of yours that you were telling me about recently. Do you want to share that with the group?
Sure. My son-in-law, who is now 41, has spent the last 10 or more years having all kinds of a variety of pain in his body, upper body, to some points where early on he'd be traveling and flying and ended up in an emergency room where they thought he was having a cardiac situation. And that has happened several times because of the pain in his upper left chest area. He's had trouble sleeping to where he wasn't sleeping. They put him on thought he had sleep apnea, even though it wasn't always totally proven. Tried the CPAP machine, that didn't help. He's been on all kinds of drugs, anti-anxiety drugs, sleep medication, pain medication. It's just gone on and on and on. And finally, he got this spring, he ended up leaving the doctor he was with and getting into a rheumatologist, and she tested his blood and told him he had an autoimmune disease, and then she did another blood test, and it showed that he has ankylosing spondylitis, which is a disease of men and women, starts in their 20s into their 30s, and he fit every part of that. So she put him on prednisone. That didn't work. Then she put him on Humira, which is $1,000 a shot.
Wow.
That didn't work, and so he's just been reading more and more about, of course, inflammation and the body. So a month or longer ago, he stopped all wheat, gluten products, dairy, anything with corn in it, sugar, and he cut out chickens for some reason. I don't know why. I guess because they eat corn. And he has lost 10 pounds, and that wasn't the purpose, but that has happened. He hasn't used pain medication for probably 3 weeks now. He can get up in the morning. He wasn't even able to get up in the morning, and he was at a point where he really thought he was dying. And after all these years of trying to find, what it is and finding out what it is, he's fixed it on his own by getting rid of the foods Judy has talked about. So he's so much better. He can get up in the morning. He's working more. It's like a miracle, to fix the gut.
Right, and that it happens so quickly. And I know when we were talking yesterday, you said that, what was he actually, some physical work, I can't remember what you said he was doing with a friend, putting in a...
Oh, his friend that works with him actually has the same disease, this ankylosing spondylitis, and a third friend of his, all from a small town here in Montana. They all three have it, which is kind of odd. And his friend isn't changing how he eats, and Oris, my son-in-law, I shouldn't say it, did, and so it's not an uncommon illness apparently, but it's fixable.
Yeah, for sure. Well, that is just an amazing story. When Sandy just shared that with me a few days ago, and I thank you so much for sharing it with the group. What we eat and how we respond to that is critical to our health. So I know I try to keep this to about a half an hour, so we're doing pretty good on time. When I started out, there's so much information to cover, but I've just, I haven't gone into this in detail. You could spend a whole day talking about all of these issues in more detail. But if you have not read the book Wheat Belly by William Davis, who is a cardiology physician, I really recommend you do. Like so many people, unfortunately, it seems like people have to find out on their own what's causing their problem. And he was gluten intolerant and didn't know it and had lots of issues. And so that's a great book I would recommend that you read. There are some lab tests that detect levels of inflammation. The CRP, or the C-reactive protein, can be done as part of the lipid panel. It's it's an inflammatory lab test that is associated with heart disease, as is homocysteine. So if you're interested in seeing what your level of inflammation might be or not be, those are some tests that you can discuss with your provider. Or if you're like me, I just go to a lab. We have a couple labs in Missoula where we can just go in and order what we want and pay cash for it and get the results ourselves. I'm more than happy to do a free consultation with anybody if you have personal issues that you'd like to discuss and see what would be best options for you. And I do want to just mention a couple of other products Unicity has for the relief of what I'm calling jointitis, like arthritis, joint pain, joint problems. But CMplex is, there's capsules and there's a cream, and you can either use one or the other. Of course, if you use both, they're most effective. But very good anti-inflammatories that are not, they're not at all like the non-steroidal anti-inflammatories, which people have to take occasionally, but they are not something you want to take on a regular basis. So CMplex is a very good option. And more recently, the company released the Unicity Joint Mobility, and that hasn't been around long enough that I've heard a lot of people that have used it yet, but I know those who have are finding remarkable relief. I know one lady was saying that she had such good results with the CMplex. She was, just not sure she wanted to try something else. Not that she can't take both, but I think she's had like 3 knee surgeries and a couple ankle surgeries and a lot of inflammatory, painful responses as a residual effect from that. And she's been very pleased. So heard that from a couple of other people. So I just wanted to mention those two. So I just want to thank you for watching the webcast, and hopefully that you have learned something about the causes and treatment for inflammation. And I just want to especially thank Sandy and Jane for sharing their stories. So I'm going to conclude with that, and thank you all for watching and wish you a good evening. I do want to say that my next presentation is going to be on December 17th, and I'm going to do that one at noon Mountain Time, and that's going to be on talking about osteoporosis and menopause and hormone issues, sort of some women's issues around that stage of life. So I hope you can join me then. So thank you so much, and this is going to conclude the webcast. Thank you. Good night.
Good night. Thanks.
Thanks, Judy.
Thank you.